Hello students, myself Nilima. I am assistant professor in Dr. Vittal Ravike Patel College of Nursing, Ahilya Nagar. Today I am going to deal with the topic normal labor. Okay, introduction. Normal labor, it is a normal physiological process through which a pregnant woman gives birth to her baby. This process occurs usually between 37 to 42 weeks, and in this process some events involved like regular uterine contractions, cervical dilatation, descent and birth of the baby. Next we will see definition of labor. It is a series of events that takes place in the genital organ in an effort to expel the viable product of conception, that is placenta, fetus and membrane, out of the womb through the vagina into the outer world is called as labor. Next we will see definition. See, it is a series of events. Series means one after another. There are some events like engagement, descent, flexion. For this is a series of events that takes place in the genital organ in an effort to expel the viable products. And viable products means that is fetus, placenta and membrane out of the womb through the vagina is called as labor, normal labor. As I said, this process occurs 37 to 42 weeks. But if it starts before 37 weeks, it is called as preterm labor. Next, we will see what is normal labor. It is also called as eutosia. Criteria for normal labor. First is spontaneous in onset and at term. Spontaneous in onset means normal labor starts spontaneously and it occurs at term. Just as said, it occurs between 37 to 42 weeks. Okay. Then with vertex presentation. Vertex means baby's head will be down. It is called as vertex presentation. It comes in normal labor. Then without undue prolongation. Next we will see criteria for normal labor. In that, first one is spontaneous in onset and at term. Normal labor starts spontaneously and it occurs at term. At term means before in between 37 to 42 weeks. Then second criteria for normal labor is with vertex presentation. Vertex presentation means baby's head will be down. Then third criteria will be without undue prolongation. Then natural termination with minimal aids. In normal labor, it should be normal termination, means without use of any forceps delivery, vacuum delivery. This is called a natural termination with minimal aids. It happens in normal labor. Then next criteria will be without having any complications, it affecting the health of the mother and baby. These are the criteria for normal labor, and normal labor it is called as eutosia. Second one is abnormal labor. It is called as dystocia. Any deviation from the definition of normal labor, it is called abnormal labor, that is dystocia. Next we will see criteria for abnormal labor. Criteria for abnormal labor, where we have seen for normal labor, criteria is spontaneous in onset and at term. Same in abnormal labor, there will be not spontaneously occur and not at term, means before 37 weeks or after 42 weeks. It is called as abnormal labor. Next, in normal labor, there is vertex presentation, but in abnormal labor, there will be breech presentation, transverse lie. This can be happen. Then criteria for abnormal labor. Abnormal labor, we can use forceps like forceps for delivery, then vacuums. This comes under abnormal labor. Next we will see most important topic in labor, that is stages of labor. So there are 4 stages. In first stage, it starts from onset of true labor pain and ends with the full dilatation of the cervix. Okay. In first stage, there are 2 phases, latent phase and active phase. Latent phase is 0 to 3 centimeter cervical dilatation and active phase is 4 to 10 centimeter cervical dilatation. It is also called as cervical stage, first stage, and its duration is for primi, it is 12 hours, and for multi, 6 hours. Next, we will see second stage of labor. It starts from full dilatation of the cervix and ends with the expulsion of the fetus from the birth canal. It is also has two phases, one propulsive phase and expulsive phase. First propulsive phase, it starts from full dilatation of the cervix and descent of the presenting part and ends with the pelvic floor. Second one is expulsive phase. Expulsive phase is distinguished by the maternal bearing down efforts and ends with the delivery of the baby. And second stage duration is 2 hours in primigravida and 30 minutes in multipara. Next is third stage of labor. It begins after the expulsion of the fetus and ends with the expulsion of the placenta and membrane. Its average duration is 15 minutes for primigravida and multipara. Last stage is fourth stage of labor. It is the stage of observation for at least 1 hour after expulsion of the baby's birth. Here you can see stages of labor: first stage, second, third stage. In this picture, you can distinguish what is forewater and hindwater. Where we can see hindwater, babies babies heads occupy the amniotic fluid, it is called forewater, and if babies buttocks back accumulate the amniotic fluid, it is called hindwater. You can see in picture. These are the cervical dilatation. Cervical dilatation starts from 0 to 3 centimeter, and at the end of delivery, cervical dilatation will be up to the 10 centimeter. Here you can see in picture. Next, events in second stage of labor. As I have discussed before, in that second stage of labor, there are two phases, propulsive and expulsive. Propulsive phase, full dilatation until touches the pelvic floor, and expulsive phase, it seems the time mother has irresistible desire to bear down and push until the baby is delivered. I would like to summarize my topic. In this lecture, we have seen introduction, definition of labor, stages of labor, criteria for normal labor, criteria for abnormal labor. Thank you.